So you've had breast augmentation or breast reconstruction with an implant and you want the implant out. Well, let's make a video about that.
Okay.
I'm Dr. Paul Zalzal. Welcome to Talking with Docs.
I'm Dr. Brad Wing, and our guest, Dr. Willoughby, is here. She is a plastic surgeon. She is an expert in this field. She's going to talk to us all about what's involved, how you make the decision, and exactly what it looks like for you. So thanks for being with us, Lauren.
Thanks for having me.
Okay, so someone, for a host of reasons, say want their breast implants out. How do they go about starting the ball rolling?
Generally, they would see, so kind of two routes. Either they see their family doctor who makes a referral to a plastic surgeon, or sometimes you just call the plastic surgeon who
Put them in?
Put them in and see if they can see you again and follow up. Because if they've been implanted for cosmetic purposes, generally that surgeon will see their patients at any point, whether it's years from the time that they operated on them.
Okay, so what are some of the reasons that people would want their implants removed?
So some people just, if they've had them in for a really long period of time, they don't want them anymore.
Okay.
When they were young or at a certain point in their life, the cosmetics of their breasts were important to them and it's no longer important to them, they want it out.
Okay.
Or they have a complication related to the implant, like the implant ruptured, or they have a capsular contracture where the scar layer that is formed around the implant has become firm, changed the way it looks.
Yep.
Sometimes that can cause some discomfort. And some patients are also concerned that their implants might be causing other symptoms that they have.
Right.
Okay, so those are some of the reasons that you might want your breast implant removed. And now what does that road look like after you've met the plastic surgeon? What's involved?
So generally you get a good history from the patient, explore why they want their implants out, what their goals are, so then you can get a sense of if you can meet their goals and how you can help them. Then of course you would examine them and give them an idea about how things might look if you remove their implants.
Right.
And then you have a discussion about what options exist when you remove them, how you can remove them, and sometimes you need imaging to see if the implant is ruptured. If it's a silicone device, you have to work in some of the imaging as well to make that decision.
Okay, so you've agreed with the patient that they're going to have their breast implants removed. What are the different surgical procedures to do this?
So all implants are contained within a scar layer that forms around them. So you have to make an incision through the skin and then you have to open that capsule at least to get the implant out, and that's called a capsulotomy. So otomy just meaning you make an incision through something. So you might consider just doing that if it's a saline implant, because if a saline implant is intact, you know because it has its volume, whereas if it's ruptured, it's gone flat.
Right.
Then they're pretty easy to remove. Sometimes you can do it under local anesthetic. If the patient has a textured implant, meaning the surface around the implant has a textured surface, they can kind of get a bit sticky, so you might remove those ones in the operating room. And then you make a decision, do you remove the capsule itself or do you leave it? And in general, you leave it because there's not a lot of conditions that from a medical perspective would warrant the removal of that capsule.
Okay, so it's definitely a surgical procedure. It may be a local anesthetic and done in an outpatient setting, or it may be done in the operating room, which is probably still in an outpatient setting. You're home the same day.
That's right.
Okay, and then recovery after that, is this like a 6-week recovery? Is this a 2-week recovery?
It's a pretty quick recovery, actually. The most annoying part of the recovery is usually put in a drain, because once you take out the implant, that space, the body will fill the space with fluid, which is called a seroma. So you need a drain to help suck it out so everything scars down flat, and you need a compression wrap or some sort of compression device to help squeeze everything together so it heals.
And what some viewers may not know is that when a breast implant goes in, it doesn't go in at its full size. It goes often through like a much smaller incision, and then it's put in and then it's inflated. So part of that procedure is deflating it. Is that accurate?
That's for a saline implant.
Only saline?
Yeah, so saline implants are inflated during the surgery, but silicone implants come inflated, and you generally put them in with something called a Keller funnel. It's like an icing baster where you put it in and you kind of squeeze it and it pops it in through a small incision.
Like a shoehorn almost. Like, because you're trying to get it through a smaller incision than it is, right?
Yes.
Okay.
We have an example of one here. So this is the size of it. So it goes in, it's a smaller size than that?
So this is a silicone implant, so
Right.
what you get is what you get. So it goes in like this. You might put it through that device that sort of squeezes it in, and then it puts it in
Allows you
through
to make a
small
smaller
incision.
incision.
Exactly.
Oh, okay. All right, whereas the saline one goes in
And you
empty.
inflate it intraoperatively.
Got it.
Would your incision after removal, is it the same size as the other one, or often has to be a little bit bigger?
Usually has to be bigger.
Right.
Because you have to be able to get your your fingers in to take it out.
Right.
And if the capsule is really calcified or really thick, or if there's a reason you might want to remove that, then you have to make the incision a lot bigger.
Right.
Because you have to be able to see it. You have to get a retractor in to dissect around it. So to make an incision to put an implant in, generally it can be a 4 to 5 centimeter incision, but to take it out, you might need an 8 centimeter incision.
Which means more pain, more bleeding, more time to recover.
Okay, so now anytime we talk about a surgical intervention, we always talk about complications. What are some of the complications of having breast implant removal?
The biggest thing for patients is their breast is really going to change in terms of the appearance. So obviously they're going to lose volume, and the nipple's going to droop a little bit more, which we call ptosis, because if there's a device in it, it pushes the breast up a bit, and then it's going to go softer and droop a bit more. It's generally a low risk surgery. I mean, of course, there can be complications. The most common ones would be seroma, which is fluid collection, or a bit of discomfort, which goes away after a couple of days. But most patients tolerate it really well.
Okay.
And then one of them that we talk about in orthopedics all the time too is, what about the unmet expectations? Because I think a lot of people for that, or removing anything, assume that a whole bunch of things or all of them are going to go away completely. Does this ever happen where someone comes for one reason, they have their breast implant removed, and they're still not totally happy with the outcome?
Yeah, so I'd say it depends on why they're having them out. So if they're concerned about their aesthetics, we have discussion before, what do? Do you just take it out? Do we do a breast lift at the same time? Do you want a different implant in? Because that one doesn't match anymore because it might be 20 years old. Some women are concerned that they have other symptoms that might be caused by their breast implants. And this generally falls into a category which we call breast implant illness, which I will say at this time is not a defined medical condition. But I've seen many patients who are concerned that their symptoms are caused from their implants. So you just have to have a very honest discussion with them that there's no guarantee at all that removing implants can make a difference to any of their symptoms, including breast pain actually. Some women can have breast pain and you might intuitively think it's from their implant, but you take it out and the breast pain doesn't go away. Because breast pain can be a difficult thing to sort out and find the cause for.
Wow. All right. Well, thank you very much for sharing that wisdom. This would have been a very difficult discussion for Dr. Weening and I to have on our own without a specialist here in that area. So
but now you know, at least if you're considering this, that there are options for you. Talk to your family doctor, talk to your plastic surgeon about the choice, and then you can make an informed choice.
Thank you, Dr. Willoughby, for sharing your expertise with us.
Thanks for having me.
And if you like this video, guys, please like it, subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.